What's the approach that we use at Peak Brain and Body, located right here in Wesley Chapel, which is just outside of Tampa? A lot of people online, and for good reason, they will often describe us as a functional medicine clinic. Now, you may not know what functional medicine is, and that's okay. I'm going to explain that in just a minute. But after we review what functional medicine is, we're going to talk about why what we do here at Peak Brain and Body, while there is some overlap with functional medicine, why it's different than what you're going to see at pretty much any other functional medicine clinic out there. So when you look at functional medicine, I want to use an analogy, okay? So we've got all these pictures of my daughter back when she was really little, and we had all these DVDs all right, they were all nicely put up. And then DVDs would magically end up all over the floor. What does regular medicine do? Well, regular medicine says, ooh, there's a mess. Boom, let's go in there, let's pick up the DVDs. And then what happens 10 minutes later? All the DVDs are back on the floor. Because the fix in traditional medicine is it's taking care of the disaster. It's not saying, well, what if we get this kid distracted and doing something else? Maybe this 1-year-old won't start grabbing all the DVDs. That is more of the functional medicine approach, right? It was my daughter grabbing the DVDs that got them on the floor. And it's the same thing when we look at functional medicine. So functional medicine, it's really a mindset, it's a philosophy where we want to identify the root cause. Now, there's a lot of different people who see functional medicine providers, okay? It ranges from headaches to brain fog to gut issues to people with chronic infections to people with autoimmune to people, and really the list goes on and on and on. And so now let's take that analogy of DVDs, right? Traditional medicine, you have headaches. Well, you have a headache, you probably need to make sure you're hydrated, you eat. Well, that's not doing it. Okay, well, have you tried ibuprofen? Have you tried Tylenol? Yes or no. If you have and it's not working, then here's the next level we go, and they keep working up. But they don't really step back and say, I wonder what's causing that headache. And that's where functional medicine comes in. And functional medicine says, you have headaches, but it says why. Or I also like phrasing it as due to what? When you understand what it is due to, that changes your treatment. So now all of a sudden, instead of your starting point being ibuprofen, Tylenol, Excedrin, or any of the other ones, your starting point is, well, due to what, right? And in functional medicine, how they start finding due to, it's going to be history, it's going to be exam, and then labs. Now, you may be thinking, well, when I go to my other doctor, they do a history. Yes, but I'm not talking usually about a 5-10 minute visit. Many functional medicine clinics will do 30 to 60. The more time you have, the more information you can collect. The better the information you can collect, ultimately, the greater the likelihood when people have chronic headaches, they're going to do better. Now, the 5-10 minute model, it does okay actually for like acute infections. Both chronic illness, you need more time to really identify what's causing things. Then exam, okay? The exam, honestly, it's usually nothing great for most people in functional medicine, which we'll talk about a little bit more. And then labs. Now, the difference is in labs, when people consider doing regular medicine labs, they're looking at about 3 to 5 vials of blood. This is the cheap test. I know your insurance probably charges you $200 to $400, but realistically, if you find someone who's got good cash pay rates, it's like $50. So it really is cheap, basic test. Functional medicine often will do 10 to 12 vials to get more information and a more complete picture, but they will also say, well, headaches due to what? And so, depending on the bias of that functional medicine provider, they may do gut testing and look at your stool. They may do food sensitivities. Those that like more adrenals are going to look at adrenal stuff. Those that like hormones are going to look more hormone. Those that like heavy metals and environmental toxins are going to look more that way. And so that's kind of the upfront difference in functional medicine compared to traditional medicine. Now, functional medicine, it is a spectrum. So please don't say, I tried one functional medicine provider, therefore I have tried them all. It's really like saying, I tried one piece of fruit, therefore I don't like any other piece of fruit because I tried a grape once. Very different. Red grape, green grape, apples, oranges, kiwis, you get the picture, right? Functional medicine is very, very broad. And in the world of functional medicine, and this is what drives people a little nuts, the skill level is all over the place. So some people really don't know what they're doing. Others are very, very good. And then you have others who 10 to 12 vials of blood actually, it's not that much and it can be done for fairly cheap self-pay. But there are those who start people out at $3,000 to $5,000 worth of just lab testing. For me, that becomes acceptable with like Parkinson's, neurodegenerative diseases. But for many of the other things, it's overkill in my opinion. So that is functional medicine. But the question is, what do you do when you have headaches, brain fog, chronic fatigue, dizziness, and others in that arena, and you work through this whole thing and you leave frustrated and you are not getting better? And this here is a weakness in functional medicine. It is a massive weakness in functional medicine. And that's not to say that functional medicine doesn't help a lot of people, because it truly does. But functional medicine on its own has an inherent weakness. And that weakness for functional medicine, it is the brain. Functional medicine does not look and evaluate the brain. Even if you have brain fog, memory issues, they are only trying to fix that through the body. So as we get your thyroid better, as we get your hormones better, as we get your blood sugar better, that's going to take care of all your neurological or brain-based issues. For some people, that is absolutely true, and that's all you need. But when it's not, you now are frustrated because all you did was collect information about body health, but you have no information about brain health. And so you have to hope that the information you collect on the body is enough when addressed to fix the brain. Now, one of the reasons we have such high success rates is we are looking at brain health. Okay? And the question is, well, how do you do that, right? Because the fact is, let's say you're like my average patient, you come in here with chronic fatigue, brain fog, headaches, mood issues, memory, and so forth. Well, which part of your body uses more energy than any other part of your body? Which one? It's your brain. Your brain uses 25 to 30% of your body's energy when you do absolutely nothing. So if your brain's not as efficient as it should be, just like if a muscle's not efficient, you get more tired when you do physical activity. The same thing's true with your brain. If your brain's not efficient, chronic fatigue is the expectation. So when we look at the brain, now this is going to confuse some people because no one talks about it, and so it's new. But new doesn't make it wrong. It just makes it new. Your eyes are known as a window into the health of the brain, because once again, your brain uses more energy than any other part of your body, and your visual system is a big user of energy. And when I say we look at brain health through the eyes, this is not like, oh, I need a new prescription. Most of the people I see, they've already been to the eye doctor hoping that their prescription could be changed and could be better. And it doesn't need to. And it's because their visual system isn't able to coordinate eye movements appropriately. So we test eye movements. We also look at balance as an indicator of health as well. Tons of research on balance. Because what we find is when this is off, and if you don't address it, even if you do the best functional medicine workup in the world, people do not get the results they could have had. Maybe at 20% better, maybe at 70% better, but people do best when they get a combined approach. And this is where it's really frustrating because let's say you're a 50-year-old female, you come in, you went through menopause 2 years before, your friend said, ooh, hormone replacement therapy is great. Online says it's great. So you go and you do hormone replacement therapy. A year later, you still have fog, you still have fatigue and other things. So clearly for you, you're like, it didn't work for me. And so you're like, I just want to stop, even though there are plenty of benefits of hormone replacement therapy. The thing is, hormone replacement therapy wasn't enough on its own to get you to where you need to be. And so I hope this is making sense, right? Maybe your issue was hormones plus gut health plus sleep plus brain. And once again, no one looks at brain. And it's not that we just look at the brain, which is, this is a critical component of our exam that no one in functional medicine does. Literally, no one. There's a very, very tiny subset of functional medicine, less than 3% of all functional medicine providers are evaluating brain health in this manner. When you take this with that, now you get the best results. And it's why I've spent so much time and money learning to connect the body as a whole, because that's really what it is about, is root cause resolution. And so by evaluating and treating neurological health, that is an essential component, because when you treat this, this is all about neuroplasticity, which is the brain's ability to connect and learn. And as that occurs, the brain becomes more efficient. As it becomes more efficient, your energy goes up. And as your energy goes up, guess what happens? Your symptoms go down. Fog goes down. Mood changes, right? Things start doing a lot better. And so, yes, at the end of the day, we are a clinic where you will see on our website, we do utilize a functional medicine approach. But for the majority of patients we see, 95% plus, we are not the clinic that starts out with $3,000 to $5,000 of specialty testing that we can't build insurance. And if we do the other testing that we can build insurance, you also have an option going self-pay, which most people are paying $150 or less to get a ton of data. And then we're always looking at neurological health up front, because when you have the data up front, we can say, hey, brain, it is an issue, or brain, it is not an issue. Now we have confidence that when we address just those things, you're going to do great. But if this is an issue, then we know even if we address those things, you still shouldn't expect the results that you could truly get. And this is how we provide complete care here at Peak Brain and Body. So if this approach sounds like something you're looking for, then I highly encourage you, go to our website, check it out, request a strategy consult with me or one of the other providers, where we will identify if we believe you're a good fit for what we do, and how we really start the process. But it really is about getting the data you need. The better the data, the better the plan that can be outlaid. So many people struggle to get better because they don't ever get the right exam up front, so you don't collect the right data. Without the right data, you cannot have a good plan. You need both. You need a good data and a good plan, not one or the other. So until next time, I'm Dr. Z, dual licensed nurse practitioner and doctor of chiropractic, and I'm known as the Brain Guy.